Yes. So, the burden of diabetes is high and increasing globally in developing economies like India, mainly fueled by the increasing prevalence of obesity and unhealthy lifestyles. Panchakarma therapy, comprising of comprehensive diabetic care as an adjunct to standard antidiabetic medication, may be sufficient to reduce the risks and symptoms in order to improve patient care and prevent complications in diabetic patients. The aim of the study was to evaluate role of Ayurveda-based treatments in remission of type 2 diabetes. The objective of the study was to attain oral glucose tolerance test negative in type 2 diabetes patients. The methodology used was as follows. The study type was observational retrospective. The number of patients included were 12. The study was conducted at Madhavbag Sambhajinagar Pune Clinic for duration of 12 weeks from July 2021 to January 2022. The inclusive criteria was known case of type 2 diabetic patients whose HbA1c was more than 6.5%, BMI above 20, and age between 30 years to 60 years of either sex. The exclusive criteria was type 1 diabetic patients, severe hepatic and renal disorder patients, BMI less than 19, pregnant and lactating females. The treatment included Panchakarma of duration 60 to 75 minutes, which included Snehan, Svedan and Basti, and diet for duration of 8 to 12 weeks according to BMI, which included 800 kilocalorie portion control, low carbohydrate, moderate protein diet. The Panchakarma therapy included Snehan, Snehan with neem oil, as it improves blood circulation, mobilizes subcutaneous fat deposits, protects skin from infection, allergies, skin diseases. Swedan was done by Dasmulkada, as it facilitates excretion of metabolic wastes through sweat, improves vasodilation. And Basti was done by Gudmar, Daruharidra Yashtimadu, as Gudmar promotes regeneration of islet cells, increases secretion of insulin. Daruharidra is an anti-hyperglycemic, reduces insulin resistance, and is hypolipidemic. Yashtimadu is antioxidative, prevents oxidative damage due to diabetes. The treatment diet modification included 800 kilocalorie diet, which is a low calorie portion control diet, thus helps to reduce weight. It reduces liver fat and normalizes hepatic insulin sensitivity and reduces glucose levels by reducing insulin resistance. Patients' vitals were monitored on day 1, BSL, BP, abdominal girth, BMI, HbA1c, with concomitant medications were monitored on day 1. During treatment, all vitals with BSL fasting PP twice a week and HbA1c every 4 weeks were monitored. OHs were tapered and withdrawn accordingly. After 12 weeks, all investigations were again performed. As oral glucose tolerance test is a diagnostic test for type 2 diabetes, so patients were advised to go for OGTT. The results were as follows. Before starting treatments, patients were on OHA and their mean HbA1c percentage was 8.6. After 90 days of CDC treatment, patient gave maximum compliance to diet and Panchakarma therapy. Their mean weight in kg was reduced from 72.45 to 65.13 and BMI from 27 to 24, while HbA1c percentage had significantly reduced to 5.6, which was highly statistically significant. That is, p-value of the study was below 0.0. The conclusion of the study was that CDC therapy is found to be effective in improving glucose metabolism to restore euglycemic status in 12 weeks of time attain GTT negative, and reduce dependency on standard anti-diabetic medications, potentially reversing diabetes. Thank you.
Okay. Thank you, Priyanka Nale. Next presenter is Dr. Sarita Patil.
हाँ दिलेली आहे फायनल वेट सरिता पाटील हे नेक्स्टला
4+1
हो
हे नेक्स्ट मागे आणि उलट प्लस
हे नेक्स्टला
सुरू केलं एकदा ट्राय करून घ्या.
Good evening all. I, Dr. Sarita, presenting here cohort study on role of comprehensive diabetic care treatment on type 2 diabetes mellitus. I have chosen this subject because we all are aware about increasing prevalence rate of diabetes in India. At present, this rate is 10%. To cope up with this, there is a constant need for better management of treatment for diabetes. In this cohort study, comprehensive diabetic care combines Panchakarma along with aligned therapy, that is diet, exercise and oral medication, which empower patient to control blood sugar without OHA support and prevent further complication. Being a clinic head of Madhav Bagh Nasik Road, we treat type 2 diabetes patient regularly with comprehensive diabetic care from past 7 years. So, for this cohort study, presently I chosen 29 patients retrospectively, of which 20 were male, 9 were female, and between age of 41 to 74 years, and BMI above 23. All patients having history of diabetes between 1 to 5 years, with 1 to 5 years with OHA support, 0 to maximum 3 types of OHA. The efficacy endpoints were two. First was HbA1c, second was gold standard OGTT. OGTT was performed by consuming 75 grams of glucose. These 29 patients treated with comprehensive diabetic care treatment along with stringent dietary modification with guided exercise and few oral Ayurvedic formulation. Comprehensive diabetic care treatment include 3 procedures, that is Snehan, Swedan and Basti. Snehan was done with Neem Siddha Tel for 20 minutes, Swedan was done with Dashamul Kwat, and Basti is a Kwat of Gudmar, Daru Haridra and Yashti Madhu, total 100 ml of Kwat. These 3 procedures applied to all patients once in a week for 3 months. During this period, patient received fixed portion of Laghu quality ahar. This diet given was low calorie, low carbohydrate, gluten free, high fiber diet. Diet was same for all patients, but according to Agni, instructions were given personally and daily exercise guidance was given. Here is treatment timeline. Procedure was done once in a week. Monitoring done strictly after 30 days. Weight, BMI, body mass index, abdominal girth, random blood sugar, HbA1c every 30, 60 and 90 days, and you can see astonishing result here. Average HbA1c reduction was 2.7, average weight reduction was 7 kg, average body mass index reduction was 3, and average abdominal girth reduction was 8 cm. After 90 days, all 29 patients having HbA1c was observed below 6.5 without any OHA support. So, gold standard OGTT was performed, and you can see all 29 patients OGTT were negative. That means their glucose tolerance was perfectly within normal range. So discussion here. As you can, the Samprapti of Prameha, according to Ayurveda, because of Kafakar and Santarpanjanya hetus, Agni is dampened. Kaf is increased with Tridosha Dushti. Kapha dosh variation mainly hampers Meda, leading to formation of a kleda. Excessive evacuation of this kleda in the form of profuse cloudy urine, that is Prabhuta Avila Mutrata, and this is Rupavastha of Prameha. This excessive kleda brings chaithilya in surrounding tissues like vasa, majja, snayu, shukra, and in advanced stage, putrefy them. Therefore, this tissue considered as dushya. Kafaruddhi, Agnidushti, Kledaruddhi, Shaitilya, Vataruddhi are important points which are to be treated. In comprehensive diabetic care program, with the help of slightly ruksha and laghu ahar, Agni is increased, Kled and Kapha are reduced with add-on exercise, and Snehan, Svedan, Basti pacifies Vata further. So, Samprapti Bhanga of Prameha happens here. Oral formulations like Amalki, Gudmar, Daru Haridra, Yashti Madhu, and Dravyas in oral formulation like Amalki, Guduchi, Haridra, Daru Haridra, Gudmar, all are Katu Tikta Kashaya Rasatmak, Ushna Viryatmak, which helps to reduce Kleda and Kapha. So, conclusion is that with the help of comprehensive diabetic care procedure along with diet modification and exercise, we can conclude that remission of diabetes type 2 without any OHA is possible. This is my team. Thank you all.
Thank you, Sarita Madam. The next presenter is Dr. Harsha Mahajan.
Namaste all. Here is Dr. Harsha Mahajan, and today I am present to you the role of Ayurveda based diet herbs in the management of type 2 diabetes mellitus. Not working. Okay. Thank you. Actually, the prevalence of rate of diabetes mellitus in India around 10%. That is, every 10% of India's adults are suffering from diabetes. So there is a highly need to treat the diabetes or reverse the diabetic. So, yeah. The present study aimed to assess the role of Ayurveda-based comprehensive diabetic care treatment, that is with the help of medication in the patient with the diabetes mellitus. Study type observation retrospective cohort, study center Madhavbag Vartak Nagar Clinic Thane West. Study periods, I have taken a data from the January 2021 to November 2021. Study duration is around 90 days and number of patients of groups are around 33 patients. Inclusive criteria is type 2 diabetes, HbA1c more than 6.5%, BMI about 21. Exclusive criteria was type 1 diabetes, low BMI less than 21, patient with chronic kidney disease and pregnancy. Methods. This cohort study was conducted in 33 patients suffering from type 1, type 2 diabetes, HbA1c greater than 6.5. Having mean age 48 to 79 years, investigation suggested the diagnosis of type 2 diabetes mellitus with obesity, hypertension and chronic heart disease. Patients were administered comprehensive diabetic therapies 60 to 75 minutes using the 7 to 21 Panchakarma procedure, that is Snehan with neem oil, Svedan with Dashamul decoction, Basti with Gudmar, Daru Haridra, Yashti Madhu and Shirodhara using Datamasi quat to reduce stress. That is, we know that there is a very much role in stress impact of diabetes in patient. Accompanied by 800 kilocalories, Prameha diet advised for 12 weeks. All the vital parameters were compared at the first day to 90 days. Our comprehensive diabetic care treatment, the main role is of Prameha diet kit, that is 800 kilocalories diet. With the help of that diet, we are also doing exercise, yoga and stress management, continuous monitoring, that is compliance and drug tapering. And the one of the most thing is Panchakarma. Diet principle 800 kilocalories portion control diet. In procedure Panchakarma, we are doing centripetal oleation. That is, we know that there is a very much highly side effect on endothelium in diabetic patients. So, external centripetal oleation or massage with the neem extract processed in, with sesame oil perform on overall body in the duration of 25 minutes. Thermal vasodilatation therapy with the Dashamul Kadha. Duration is 10 minutes, and as I told you, the Basti, that is with Gudmad, Daruharidra and Yashti Madhu for 15 minutes, 10 to 15 minutes. Result is, here you can see the day 1 and day 19 improvement analysis. In these 30 patients, there is a weight reduction is average 2 to 3 kg in 90 days in the BMI 2.2 or HbA1c it is 8.35 to 7. Discussion. Snehan improve vascular tone. With the help of Snehan, it helps to improve vascular tone and activate skeletal muscle for glucose uptake. Swedan remove excessive salt and water to prevent overload on kidney. Basti improve the beta cell function and reduces insulin resistance. So diet, as I told, diet is a very important role in diabetic reversal treatment. So here we are offering portion control diet, low calories, low carbs diet. Conclusion, Ayurvedic Panchakarma therapy along with the portion control 800 kilocalories diet helps in the reduction of HbA1c in type 2 diabetic patient. This treatment can help the first line of therapy in type 2 diabetes management. Thank you.
Thank you, madam. Next presenter is Dr. Pallavi Pawar. Dr. Pallavi Pawar.
Sir. Okay, back. Good evening all. Here, myself Dr. Pallavi Pawar from Madhavag Medical Square Clinic as well as Assistant Professor at Bhausaheb Ayurveda Mahavidyalaya, Nagpur. Today I am going to present a case series entitled Role of Low Carb Diet and Panchakarma Therapy in Reduction of Glycolated Hemoglobin with special reference to diabetic retinopathy in type 2 diabetes. While studying for a research article on diabetes mellitus, I came to the point that prevalence of complications of diabetes type 2, and I came to the point that in type 1 diabetes and as well as in type 2 and type 1 diabetes, prevalence of diabetic retinopathy is more in when the disease duration is more than 10 to 20 years. Then the risk of getting diabetic retinopathy is 70% more than the normal person, 70 to 75%. As all of us knows very well that diabetic retinopathy is a microvascular damage to the blood vessels in retina. Before moving ahead towards patient, we should know normal and abnormal diabetic retinopathic retina. As normal retina, you can see all the anatomical structures there are seen clearly, and in diabetic retinopathic retina, you can see the yellow and red patches, that is retinal hemorrhages, as well as the dried carbohydrates, cholesterol dots, which we call hard exudates. Now, these are the three patients which are included in my studies. While studying that prevalence, we have campaigned for the diabetic retinopathy study, and 24 patients were screened up for retina scan, and amongst them, 8 patients were diagnosed with diabetic retinopathy, And amongst that 8 patients, 3 patients come up with an amazing result, and we observe that those 3 patients more cleanly. Then come to know that the first patient was 59 years old male, which is, who is having 20 years more than disease duration of diabetic type 2. Then and baseline HbA1c level, that is glycosylated hemoglobin, was 10%. Then second one was 56 years old male patient who is having 20 years of history of diabetes and having baseline HbA1c was 8.9. And third one is 62 years old female patient who is having history of 12 years of diabetes and having HbA1c level baseline 8.8. All the 3 patients were assessed on regular clinical parameters and laboratory parameters and treatment as well as retina scan, and treatment was given as low carb diet, that is 800 kilocalorie diet, apatarbanjanya ahar, as well as they were treated with a daru haridra amalki gudamar dried extract and panchakarma therapy. Baseline treatment, average of 3 patients, the HbA1c level was, all the 3 patient average was 9.2%, and now after treatment they were come up with 6.5% HbA1c levels. How it get? Here is a result, that is parametric analysis, how they dropped down. We had 4 consequent reports of their glycosylated hemoglobin, and first one is came up with 10 to 6.1, second one is reduced his HbA1c level 8.9 to 6.2, and third one from 8.8 to 6.8. Now we will come to the scanning. First patient, you can see completely opaque retina. No structure, no other anatomical structure is there. And after treatment, you can see all the retinal vessels are seen well. Fovea, optic discs are well visible. Then in second, complete vitreous hemorrhage, which makes the retina opaque. And after treatment, you can see all the vessels clearly. This third one patient has same vitreous hemorrhage after treatment and before treatment. And before treatment, one more clinical symptom was there which occur in retinal scan, that macular thickness, central macular thickness, CMT जिसे हम बोलते हैं, that CMT was raised in the third patient, that normal retinal thickness should be 250 to 270 to 250 to 270 macro mm. But in the third one patient, macular edema is so severe that her retinal thickness was 490 of left eye and 480 of right eye. After treatment, you can see her macular thickness reduced by 800 kilocalorie diet and panchakarma therapy as well as oral medicine, and her retinal thickness reduced to 250 and 270 range. So, discussion part, as all since morning we are seeing low calorie diet and polyherbs, how can it reduces HbA1c? Here to point discuss how HbA1c, reduce HbA1c can avoid the complications and progression of disease of diabetic retinopathy. Here is my conclusion. Decreasing carbohydrate intake results in lower insulin production levels, which causes the body and forces the body to use its stored fat and protein as an energy source, and lowering glucose level, reduction in HbA1c. Diabetic retinopathy is preventable through the strict glycemic control and the annual dilated eye examination by ophthalmologist. That's all. Thank you all.
Thank you, Dr. Pallavi. The next presenter is Dr. Sumaira Sabir. You'll get 4 plus 1 minute.
Okay. So this one is
This is 4. You can follow. Okay.
yes.
Hello, good afternoon everyone. I am Dr. Sumara, Senior Consultant of Madhobag Dhantoli Clinic, Nagpur. Today I am presenting my presentation and my topic is role of Ayurveda-based comprehensive diabetic care program in remission of type 2 diabetes mellitus. As we know that diabetes is a multifactorial metabolic disorder affected by million people all over the world. Prevalence of diabetic mellitus is increases in the world. Its pathophysiology involves two types of mechanism. Insulinopenia, it means pancreas cannot produce enough insulin required by the body, and insulin resistance. Lack of responsiveness of peripheral tissue to insulin, impairing glucose utilization, and hence hyperglycemia. It's diagnosed based on the blood glucose level. Fasting is more than 125 and post-meal is more than 199 considering diabetes. In recent year, we are also using another tool that is called HbA1c. HbA1c more than 6.5 is called diabetic stage, and less than 6.4 is considering pre-diabetic stage. As we know that prevalence of diabetes is rising, alarming worldwide. India is only second to China in terms of prevalences of diabetes. With the prevalence of diabetes rate is 10%, that means India 10th of adult in India is suffering from diabetes. Despite various OHA like bigonides, alpha glucoside inhibitor, and insulin are used for the treatment of pre-diabetic and diabetes. Still, they are unable to control the blood sugar efficiently. Here, we are using comparative diabetic care program to improve HbA1c of the patient and make patient diabetes free. Comparative diabetes care program including Panchkarma therapy, in which we are using Snehana, Swedana and Basti, polyherbal formulations, dietary management and lifestyle modification. Snehana, using neem oil, the timing of Snehana is 30 to 35 minutes. Swedana, that is using Dashmul Kada with 15 to 20 minutes, and Basti, a mixture of 40% Gulmar, Daru Haridra 20% and Yashtu Madhu. Material method, sample size is 49 and observational study. Duration of study is 12 weeks, that is 3 months, and study site is Madhobag Dhantoli Clinic, Nagpur. Including criteria, males and females, that is age of 30 to 80 years. BSL fasting is more than 125 and post-meal is 199, and HbA1c is 6.4%. Day first, CDC is a 4-step procedure forming on the patient with type 2 diabetes mellitus. After a diet breakfast, on setting of the procedure took 6 to 70 minutes. Here, the patient with more than HbA1c 6.5% is including, and other parameter like weight, abdominal girth and BMI also measuring. 21 sitting of CDC in 3-month duration with 800 calorie diets we are planning for patient, and 30, 60 and 90 days of follow-up, all tests performed at day 1 and respectively, and parameters are measured. With after the GTT, after HbA1c reduces, we plan OGTT test, that is called glucose tolerance test, and we perform that test and consider the patient at diabetes free. Here, statistically analysis, we are using group of quantity data, so we are use t-test here. The p-value of all the patients is significantly, statistically significant. Here, overall effect of CDC on body parameters, weight reducing by 8.1% and ABG reduced by 10.1%, and BMI is reducing by 5.5% averagely. Other parameters also significantly improved. The more important parameter, that is HbA1c, reduced by 2.1%. Here GTT parameters showing all 49 patients. Observation,
Before starting the treatment, patient on OHA and the other mean HbA1c is 8%, it reducing by 5.7%. Their mean weight, the main weight is also reduced, and the main important thing is patient's OHA was completely withdrawn and their sugar level almost come to normal, and hypoglycemic condition, the OHA is completely reduced. Due to the discussion point, Panchkarma is an international detoxification procedure in which the Swed in Snehana content reduction of lipid production in the body, thus correction dyslipidemia. Swedana introduces sweating to steam therapy, which excretes excess sodium, water, with reducing stress and vascular endothelium with a busty amyloid deposition and sanitizing insulin resistance. The conclusion, CDC therapy is found to be effective to improving glucose metabolism to restore the eglycemia status in 12 weeks of the duration, attending GTT negative and reducing dependency of standard anti-diabetic medication and potentially. As a study considered here is non-comparative and retrospective, and with a smaller sample size. These are some limitation of these. Thus, we recommended condition of the similar study with dual arm on large population to allow direction compensation. Thank you so much.
Thank you, Dr. Sumaira. The next presenter is Dr. Shivaranjani. Shivaranjani K. Is she here and present in the auditorium? Then the next one is Dr. Sushmita Rani. Sushmita Rani. Forward. 4+1. You are from Madhava? You are from Madhava?
WhatsApp. No.
Now. Tell them your name.
Sushmita.
Jyotishmati quiz final round is there in open air auditorium at 5:30 p.m.
Good evening all. Myself Dr. Sushmita Rani, studying first year MS in Shalyatantra department in JSS AMC, Mysore. My topic is surgical repair of a direct inguinal hernia, a case report. Hernia means to bud or to protrude or offshoot. A hernia is defined as an area of weakness or disruption of the fibromuscular tissues of the body wall. Often hernia is also defined as an actual anatomical weakness or defect. Hernia is also defined as an abnormal protrusion of a viscous or a part of viscous through an opening, artificial or natural, with a sac covering it. Inguinal hernia is the most common hernia, 73%, because the muscular anatomy in the inguinal region is weak, and also due to the presence of natural weakness like deep ring and cord structure. Indirect hernia is more common than direct. Hernia is of two types, indirect and direct. Indirect hernia, it comes out through internal ring along with the cord. It is lateral to the inferior epigastric artery. Direct hernia, it occurs through the posterior wall of the inguinal canal through Hellas back triangle. According to Acharya Sushruta, aggravated doshas causes premonitory symptoms like no signal. Here is a case report. A 76-year-old male patient got admitted under Shalyatantra Department of JSS AMC, Mysore on 12/6/2022 with complaints of protruding mass in the inguinal region accompanied with the pain since last 3 years. History of illness. As per the statement of the patient, he was apparently healthy before 3 years. He gradually noticed mass along with pain near the inguinal region. Mass comes out while coughing, walking, straining for motion, lifting heavy weight. In the last first month, the mass has increased in size, hence the further management he has approached our hospital. History of past illness. He is a known case of COPD on medication in the last 10 years. As this is the main cause for causing hernia. History of surgery for inguinal hernia on right side. 4 years back, clinical findings on examination. Other general condition was normal. On para-abdominal examination, soft and non-distended, tenderness noted at left iliac fossa. Local examination, location, swelling over the left inguinal region. On inspection, discoloration absent, swelling present, pigmentation absent, and other specific examination of inguinal hernia. Internal ring occlusion test came positive, ring invagination test positive, Zeeman test and head leg raising test came positive. Other investigations were normal. USG abdomen and pelvis shows impression grade 1 prostatomegaly, small prostate cyst, small angiolipoma in right kidney, left-sided direct reducible inguinal hernia with loop of small bowel and its mesentery as content. Treatment, preoperative methods were followed. Operative procedure, as per herniotome and herniorrhaphy, all protocols are maintained. Later, post-operatively, the precautions taken for the surgery and post-operative management has been done. Later on, for the advice on discharge, the images shows before surgery, the swelling in the right iliac fossa. During surgery, safeguarding cord structure. Closing in the fascia with suture, completely closing internal layer and sutures. All images shows the follow-up after the 10th duration in the last image. Advice on discharge. Tap Chitrakadi Vatti, tablet Shwasakuta Rasa. Dashamularishta, Triphala Gugulu, Gandhaka Rasayana has been advised. On discussion, precipitating causes should be treated first. Precipitating causes should be treated or controlled first, like asthma, tuberculosis, bronchitis, chronic cough, stoppage, smoking, treating enlarged prostate by TURP. Conclusion, treatment for inguinal hernia is always surgery. However, asymptomatic direct hernia patient can wait without opting for any surgical intervention. Acharya Sushruta was capable enough to explain the Nidana, Samprapti and Chikitsa of inguinal hernia as under topic Antravriddhi. He also justified the reason behind naming Antravriddhi and Mutravriddhi is because they are named based on their contents. Other Vriddhi rogas can be correlated to swellings which occurs in this region. Treatment for before them, suppuration, Raktamokshan and Doshagna. Thus here, by considering all these things, we can proudly say that Sushruta tried his level best to explain hernia completely. It is very important step before going for the surgery of hernia. We have to treat the cause first. That is, the patient having COPD since last 10 years, he developed hernia. So treating hernia in surgery and also COPD later on is the best method. Thank you.